kami selalu greet annyeonghaseyo, macam tu. Baik, allow me to share my screen. Alright, Sister Nabila, can you confirm you can see the slide presentation?
Yes.
Alright, thank you. Alright, so today our topic will be managing traumatic dental injuries in children, race against time. Now, I have been given, I delivered like a couple of number of webinar or top lectures in dental trauma. However, this is my first time giving to audience who are mostly non-dental. So I have to talk a little bit my presentation so that I will not go into detail of a dental part so that not to confuse you. The aim of this lecture is not for everyone to manage dental trauma. It is not meant for you to replace our management, but it is meant for you to identify and to create awareness of some of the urgencies in managing dental trauma. So that's hence the title, Race Against Time, right? Now, as for content, this is my presentations, the content of my presentation for today. Basically, I will do a little bit briefing of introduction of what is dental trauma, right? And then we will go to the knowledge of non-dental healthcare personnel on dental trauma. Before we speak about dental trauma, let's look at the published evidence or studies that have been conducted among other healthcare personnel, staff nurses, medical doctor, ED physicians, medical specialists, right? Even they also do some studies among the ambulance staff who are first aider to see whether they have enough knowledge or not on dental trauma. And then after that, we will go into what were meant to be the pivot or the main topic of today's presentation, which is managing AVULSED permanent tooth. Now, I will go into details what are the definition after this. Now, before I start, these two are my mentors. For those who don't know, I am in the middle. Saya kat tengah tu lah. Okay, walaupun nampak macam yang belah kanan tu kulit sama macam saya, but unfortunately, I'm not lah. Those two are my lecturer when I was studying in Hong Kong U, right, in Hong Kong. So I'm in the middle. At that time, I was groomed. Actually, it was a viva session, a mock viva session for my exam. So it's quite stressful as well when your supervisor sitting just next to you, right? Now, when we talk about dental trauma, it is not complete if you don't address this association. Now, there is one association, we call IADT, or International Association of Dental Traumatology. This association dedicated their work basically on dental trauma. Right? They first started in Sweden, if I'm not mistaken, as a World Federation of Dental Trauma. But after that, they changed their name into International Association of Dental Trauma. And this is not only meant for research in dental trauma, but it also meant for dissemination of knowledge and information, not only to dental healthcare practitioners, but also to other healthcare practitioners and also to the public. Now, they also publish one, what we call dental trauma guide, which is meant for guidance. If you want to go to this website, dental trauma guide, you can have a look at different types of dental trauma, how to manage it, all the very basics, right? And apart from that, they also had this journal, a very well-known journal, what we call a dental traumatology, or Journal of Dental Traumatology. Now, this journal has been what we call a reference, especially in dental trauma research and education, right? Now we go for the introduction, a little bit of the introduction. On average, right? On average, 1/3 of people suffer a traumatic dental injury of some point in their life. Meaning that if we have like 100 of us, around 30 plus will suffer traumatic dental injuries throughout our life. Okay, the injuries, the traumatic dental injuries include fracturing of teeth, crushing and or fracturing of bone, and soft tissue contusion, abrasion, and laceration. So it can be the tooth itself that is traumatized, or it can also be the soft tissue, or it can be both, combination. Injury must be assessed carefully as the treatment provided immediately after the injury has a major influence on prognosis. So this is very important because right after injury, the first aid treatment that provided in dental trauma will determine the prognosis, whether the tooth will survive or not, whether the prognosis will be good or not. So the immediate treatment or the first aid treatment is very important. Now, for most of the cases, traumatic dental injury, the treatment can be accomplished or can be delivered without too much difficulty. So some of the dental trauma are very straightforward. Okay. Unfortunately, prompt and proper treatment is also not always carried out as emergency care. It's often provided by non-dental healthcare personnel. For example, if you have MVA cases, a motorcycle accident, for example, and there is ambulance services came in, so chances are they will not look at dental part in. I mean, it is understandable that the emergency services should come first, but at the same time, if you can also some sort of like review, look at the dental component as well. Now, what are the risk factors for dental trauma? Who are at risk to have dental trauma? All right, there's a few groups. The first one is those who are increased overjet with protrusion. Increased overjet here means those who are, kalau bahasa kampung ni panggil jongang lah. Protrusion ni maksudnya gigi atas dia ke depan. The more protruded your teeth ataupun the more gigi you jongang, the higher the chance for you to get dental trauma. Which is logic because bila you jatuh kan, you jatuh kat depan dulu. So the more protruded, the more jongang you are, the higher the risk for dental trauma. Okay, imagine someone yang gigi dia terlalu jongang sampai kan nak buka pintu pun tak boleh, tersekat dengan mulut. That is very high risk for dental trauma. Tapi tak adalah macam tu, tak adalah sampai ialah nak buka pintu pun tak boleh kan, terlanggar dengan apa gigi, tak. But the point is the moment kita punya gigi tu jongang dia tu lebih daripada 4 mm, we are not talking about centimeter, we are talking about millimeter. Lebih daripada 4 mm, you are actually at risk for dental trauma. Second is risk-taking children or adolescent. No, my specialty is on pediatric dental specialist. Hence, my presentation will cover mostly children. However, it is also some can be applied in adolescent and adult as well. Now, for the other risk factor is risk-taking children. Now, our children, we are more exposed to YouTube, to online social media, hashtag challenge. Kan kalau kita tengok in TikTok or in YouTube, there's a lot of challenge, right? Some of these risk-taking will be at risk for dental trauma. Lepas tu hashtag YOLO. YOLO, saya pun tak ingat YOLO, you only live once, kononnya. Alright, another risk factor for dental trauma is bullies and abuse. And we have seen that in the literature, in the child abuse cases, it is reported that almost 15 to 20% will have dental trauma. Okay. And then those who are in the group of physical sport, those who are involved with physical sport, main rugby, main bola, kayak apa, any contact sport lah, physical contact sport. Congkak dia tak kira contact sport. Batu seremban you main bukan contact sport, tak ada masalah. Carrom pun tak ada masalah. Alright. Another group of children who are at risk for dental trauma is ADHD children. ADHD children or children who have attention deficit hyperactive disorder, who are hyperactive. Okay, bila dia hyperactive, they tend to get physical, right? Another risk factor is actually those who use inappropriate use of teeth. Maksudnya orang guna gigi untuk makan, untuk gigit, but they use teeth for other things. Contoh nak buka botol, guna gigi. So it can lead to dental trauma. Tiba-tiba nak buka guna gigi, nak buka botol tak ada buka, gigi yang tercabut. Okay. Now, how common is dental trauma? So when we talk about dental trauma, is it common or is it not that common? Now, the answer is that there is one study, they did a study, this is published in Dental Traumatology, right? They did a study of 1 billion living people. Bukan 100 orang, bukan 1000 orang, 1 billion. Okay. What they found out is actually this condition, the dental trauma, would rank 5th. Kalau ikutkan, dia rank number 5. Selepas kalau kita if the study shows that this condition would rank 5th if it were included in the list of main chronic disease. Okay, but dental trauma is not included in the chronic disease. If it were to be included in the chronic disease, dental trauma would rank 5th, number 5. Itu selepas caries, yang caries gigi, and then headache, sakit kepala, anemia, hearing loss. Okay, and then after that, kalau masuk, then dental trauma, after that migraine. That is how common dental trauma is. Okay. Now, before we go into details, I would like to share with you some of the type of dental trauma. Right? Again, we have primary teeth, which is gigi susu, and we also have another set, which is permanent teeth, gigi kekal. Kalau kita ni semua dah ada gigi kekal lah, tak ada dah gigi susu ni. Janganlah ingat, oh aku ada gigi susu lagi ni. No, gigi susu selalunya, usually the last gigi susu akan terkeluar or akan exfoliate at the age of 11-12 tahun atau 13 tahun. After that, most of the time it will be permanent teeth ataupun gigi kekal. Now, what happened in dental trauma in primary teeth is that if you notice that, kalau you tengok gigi susu ni, the root of the primary teeth is very close with the developing permanent. Kat bawah ni adalah gigi kekal yang tengah nak develop. So anything happen to the primary tooth or baby teeth will have effect on the permanent tooth germ yang tengah develop. So that's why when we address the parents when they come with their child who had dental trauma, we also advise that there might be some complication to the permanent dentition even though the permanent is not yet erupted. So that bila permanent come out, erupted, tak adalah mak dia terkejut. Tengok, kenapa gigi anak I macam ni? Bengkok-bengkok. That one is another sequelae. I will not cover in this lecture. Just to show you, these are some of the type of classification, the type of trauma. It can be concussion. Okay, concussion ni bila jatuh, gigi tu tak goyang, is still there, cuma you rasa sakit sikit. And then you can have also other type, subluxation, extrusion. Extrusion ni gigi tu terkeluar sikit, dia nampak panjang sikit. And then you can have avulsion. Avulsions ni, the whole tooth come out from the socket. Satu gigi tu semua terkeluar. You also have intrusion. This is intrusion kat sini lah. Okay, intrusions mean the tooth was pushed inside. You nampak gigi tu macam pendek. Okay. So these are some of the example of traumatic injuries in primary teeth. And also in the permanent, it's the same thing. Okay, you have concussion, you have extrusion, you have avulsion, you have intrusion. Now the reason why they actually separate between primary and permanent is actually because the management of specific traumatic injuries in primary and permanent are different. If the patient comes to you with avulsion of primary dentition, you tak risau sangat, gigi susu. But if the patient comes to you with a permanent tooth that is avulsed, gigi terkeluar, then there is a concern. Right? So in primary teeth, the treatment usually very straightforward. It is more of reassuring the parents, carry out some emergency treatment for the patients, and then you reassure the parents what are the possibilities of it will affect the permanent dentition. Now, it happened in the permanent dentition. Of course, permanent dentition gigi tu dah tak ada gigi lain dah kat bawah. Okay, then you have to by concept you have to save the tooth, meaning that as much as possible, because it is permanent gigi kekal, you want to save the tooth. The moment you cabut gigi kekal, dah tak ada gigi lain dah. Kalau gigi susu, kalau you cabut, kemungkinan gigi kekal tu akan keluar dekat situ. But if it is permanent, the moment you cabut, then tak ada gigi dah nak ganti kat situ. So the aim of the management in the concept of the management in permanent teeth is always you try to save the tooth, right? What we are going to discuss today is the most severe type of injury, which is avulsion. Now, why we focus on avulsion? Because avulsion is very special. Avulsion is the only type of dental trauma that has timeline. Alright, I will show you later. The other type of dental injury, the management, they say it's always like if you have this type of injury, dental injury, refer immediately. But how immediate, they don't mention. For avulsion, you have to complete the treatment within 1 hour or 60 minutes. We will discuss later in the brief. Now, these are the rest of the slides. I'll just show you some of the type of dental trauma so that you can appreciate what we are dealing with. So if you notice here, for the untrained eyes, right? So you can't really appreciate much which one is which. But if you notice here, I don't know if you can see, this is a fractured tooth. Now, if you notice here, there is a bluish color. This bluish color is actually the pulp ataupun saraf gigi tu. So dalam gigi dia ada saraf. Dia ada pulpa. Okay, within the tooth there is pulp, saraf, and then there is pulp lah. Dalam pulp tu ada saraf, ada salur darah. So when the tooth fractured, you will see the pulp. You will see the nerve ending kat sini lah. You cannot see the nerve ending, but the nerve ending is still there. Imagine you have any kita panggil apa tu action ke or any you makan ke, suddenly it goes straight to the nerve ending. It is very, very painful and it is very, very sensitive, right? So this is another type of dental injuries as well. This one was referred to as the dentist actually put the wire on the inside. Usually we put on the outside. Okay. The reason why we put outside is actually because if you wanted to do root canal treatment, then it will not hinder the root canal treatment. For example, like this one, if I had to do the root canal treatment for these two teeth, if you notice that these two teeth fractured, dia ada patah. So if I had to do root canal treatment, it will be very difficult because I cannot have access to the tooth because of the wire. So that's why sometimes in dental trauma, we put the wire on the outside. So that any treatment that we wanted to provide, especially root canal, it will not be hindered by the presence of the wire. Okay. Again, this is another case. If you notice that this tooth is a very innocent, you cannot see anything. But when we do transillumination, transillumination is where you put the light and then you akan nampak a crack line. Okay, there is actually a crack line extending from here until the root. Kalau kita tengok sekali bas macam okey ni, nampak okey. But then when we put transillumination, kita check dengan cahaya yang terang, you will see there is a crack line extending sampai ke root. So that's why we did root canal treatment. We use microscope. Fortunately, the tooth can be saved lah. Now, these are another type of trauma that we see, mostly seen in ED or usually in green zone that was referred to us. Okay, if you notice, this is gigi susu, primary teeth. Okay, it was actually pushed ke dalam. Right. This is also another case of multiple injuries. Usually dental trauma, very rarely you have one injury. Like I mentioned just now, you have this type, this type, this type. Most of the time, it will be multiple. Okay. Now, in this case, you can see that the tooth, the upper tooth already fractured. Okay. It is very sharp. And unfortunately, during the trauma, the patient bite his tongue. So you can see that the patient of these sharp edges, the patient bite the tongue. Right. So we managed to actually do sutures. This is also another case of avulsion. Unfortunately, the parents did not bring the tooth with them, right? So this is just to show you a case. There's a tooth here, but it was knocked out. It was avulsed. Dia dah terkeluar. Tapi parents tak tahu kena bawa, so dia tak bawa gigi tu to dental clinic. This is also to show you of a combination of soft tissue and hard tissue. You can see that the upper lip, there is a there is a laceration wound there, and then there's a multiple dental trauma involving primary tooth. Okay. This is another case where the tooth is actually not completely knocked out, but it's actually slightly pushed towards the labial. Dia terkeluar sikit. In this case, you can see that there's still blood there, but the tooth is actually pushed terkeluar sikit. Alright. So in this case, what do you do? Usually when the patient is very lucky. This patient is very lucky. Patient ni sangat bernasib baik because of two things. Okay. Yang pertama, the patient is very lucky because the patient is cooperative and oral hygiene, kebersihan mulut dia bagus. Okay. Yang kedua, the patient is very lucky because the patient was referred to me. Kalau dia refer ke orang lain, datang gigi tu kena cabut. But because the patient is referred to me, so I decided, I asked the mother said they wanted to keep the tooth. So when I check, gigi tu walaupun dia terkeluar sikit, tapi dia stable dekat situ. So we decided to review. So when we review, this is after 5 days, I think 5 to 7 days, you can see that the healing take place. Alright, the tooth is still there, it's still high, but it is not mobile. And then after 1 month, this is after 1 month, you can see that the tooth slightly turun ke bawah, masuk balik tempat dia. You will not get the ideal position or the original position. However, it will go down to a certain extent, then dia akan stop kat situ. Well, in this case, this is after 1 month, right? So it is acceptable for the parents. Okay. This is another case, quite interesting juga. There are 2 teeth kat sini, the primary teeth that were pushed inside. Imagine these 2 teeth are actually similar to this. Okay, these 2 teeth was pushed inside. Both of this was pushed inside completely, termasuk gigi satu, semua gigi crown tu, kita panggil crown yang warna putih tu, all of the crown was pushed inside. Semua termasuk dalam gigi tu, dalam gusi. So imagine how painful it is. So these 2. So when I received this case, I decided we just want to review, right? See how it goes. Hopefully the tooth come out. If the tooth did not come out, then we have to take out the tooth, right? There's a guide how you want to review, how long you need to review. So when review the patient after 1 week, you can see that healing already take place. The tooth already started to come out. Dia macam bila dia kena tolak gigi tu, dia masuk ke dalam. Kadang-kadang dia merajuk tak keluar langsung. Tak nak keluar dah, dah kena tolak ke dalam, tak nak lah. But sometimes the tooth dia semangat sikit kan, dah kena tolak masuk ke dalam, tak apalah aku nak keluar balik. It takes time, alright. This is after I think one week plus, you can see that the tooth is actually coming out, half of it. And then when we review it further, right, so you can see the tooth dah start keluar sikit. Okay, so again, you cannot expect the tooth to be in the original position. However, it is better to have that tooth there rather than if you expect earlier. Alright. Alamak, tak gerak. Okay. So again, as I mentioned just now, the case I actually I sometimes write in the newspaper. This is what the case just now I mentioned, because I think creating awareness is important, especially among public and among parents, that dental trauma is not that difficult to be managed, right? So I did one article in the Star in 2018. You can see that it's the same case that I presented here that I published in the Star, right? Again, these tooth, for those who don't know, the tooth actually has been pushed. This is the tooth. Imagine the tooth is originally here. The tooth was pushed up to this. That is how big or how hard is the impact. Okay, to push the tooth, kalau kita tolak dengan jari tak boleh. Imagine the impact of the trauma, jatuh ke, dia kena langgar ke, that managed to push the tooth from here up to here, right? So when you see that kind of trauma, so you have you can imagine the force that has been directed to the teeth, and you can imagine as well that the higher the force, there will be some other trauma as well in the face or in the jaw, right? This is again another case of intruded. The tooth actually fractured. Okay, front tooth fractured and was intruded. So how a quick way to see whether the tooth is intruded or not is actually you can see the gum. Okay, sometimes the patient, especially children, they are not cooperative. Jangan kata kita nak buat treatment, kita nak check pun dia tak bagi. So sometimes I have to ask the parents to check for me, to take photos, ataupun parents boleh duduk pegang. They are the parents punya tangan, that's why dia tak pakai glove. And some of the photos I have to make a disclaimer. Some of the photos are actually taken BC. BC means before COVID. Okay. So if you can see, there's a bulge here. So there are chances that the tooth has been pushed inside. Sebab crown dia besar kan, bila dia masuk ke dalam, gusi tu jadi bengkak. There are other possibilities as well, such as for example like the kita panggil socket tu dia patah, jadi that's why dia nampak besar. So it just give you an idea that something is there. Either the tooth is pushed inside ataupun it is actually a socket gigi tu yang dah dipecah. Okay. This is nothing to do with dental trauma. This is just to show you a case that this was I think way back when I did my houseman lah, we call it houseman Fido. We received like a referral. This guy actually they were playing with nail gun. Pernah tengok tak nail gun yang apa? Peluru pistol nail apa nail gun lah, nail gun. So unfortunately dia tertekan and then it was shoot to his friend, and luckily there is no other injuries. It's purely soft tissue and it really miss eye betul-betul kat depan mata tu. So that is how fortunate the patient is lah. Alright. Now that we have seen some of the type of dental trauma, you can see that the different type of dental trauma. Let's look at the knowledge among non-dental healthcare personnel on dental trauma. Alright. Let's look at what are the perception or knowledge of ED physician. Look at the knowledge. What are the knowledge among ambulance services staff, because they are the first aider person who will be in the traumatic scene. So what are the knowledge of medical student, for example? Now let's look at the evidence published in the literature. Now there's a study who did publish, I can't remember JDC. It was published quite recently, knowledge and management of traumatic injuries of ED physician and resident in UAE, in Arab. Okay, so this study, what they did was they wanted to know whether those residents or physician in ED department, whether they have knowledge, enough knowledge, sufficient knowledge on managing dental trauma. This study was conducted in Arab, okay, UAE. Now what they found out is that, what they concluded is that from the result of this study, okay, the overall knowledge of traumatic dental injury and their management among ED doctors across UAE were inadequate, meaning that there is insufficient knowledge. Okay, knowledge of traumatic dental injuries was the highest among consultants and specialists and lowest among GPs, meaning that maybe during the training of the consultant of the specialist, they had this maxillofacial or dental trauma module. However, for GPs, they don't see that much, and in the training of during the MBBS or MD training, they don't have this input. So that's why the knowledge, if you compare among the medical, they had consultant and specialists had higher knowledge compared to GP, right? And the traumatic dental injury knowledge level dropped 5 years after graduation. So once you graduated, you have some sort of knowledge about dental trauma. What they did was after 5 years, everything dropped. So what they suggest is actually to have a regular training or awareness, like what we did right now. All right. Now, apart from UAE, there's also another study. What they did was they test the knowledge of physician in hospital emergency room in Israel. This study was published in IJPD, International Journal of Pediatric Dentistry. They wanted to test the knowledge, to see the knowledge of physician in emergency room. They conducted in Israel to manage or to know their role in management of avulsion of permanent incisor. These are what we are going to discuss, the type of treatment, avulsion. So what they found out is that it may be concluded that a medical student and physician in hospital emergency room should be made aware of their possible role in cases of avulsion of permanent teeth, and in order to minimize later complications associated with such injuries. Now, it seems that in this study, the physician or the resident in hospital emergency room in Israel did not know much their role in managing avulsion. All right. So what I'm going to discuss at the end of this presentation is what are your role in managing avulsion. If you are a non-dental healthcare workers, what are your role? How can you help us in managing avulsed permanent anterior teeth? All right. So this is in Israel. All right. They also do a mini review. They look at the medical doctor's knowledge of dental trauma. Right. So what they found out is actually from the result, overall, the medical doctor's knowledge on dental trauma is inadequate, and it warrants intervention from the medical educators to close this gap, meaning that there is a gap of knowledge, right, among medical doctors on managing dental trauma. Okay, so we have seen the medical doctors, they have done study on the ED physician, both in I think in Turkey and also in Israel. And then apart from that, they also did study, all right, on the emergency ambulance services to see the knowledge, the staff or employee in the emergency ambulance services, the first aider. Okay, what they found out is that the study has some limitation. Although there is lack of proper knowledge on emergency management of dental trauma among the employees of the emergency ambulance services, right? There was willingness among them to gain knowledge, meaning that some of them, they appreciate that, okay, I didn't know much about dental trauma, and they are willing to learn more, right? As they are the first people who are approached whenever there is any emergency, right? So meaning that though this study found out that there are insufficient knowledge, but they are willing to learn about dental trauma. And then we look at also the pediatrician, all right, the medical pediatrics, the perspective on dental trauma. They did like a very a small, simple cross-sectional survey. This one was conducted in India. They want to see what are the pediatricians' perspective or knowledge on dental trauma. So I think this is published in Journal of Indian Public Health. All right, so among the pediatrician, what they concluded is that the knowledge regarding the handling of avulsed tooth, the medium of transportation, and the significance of time lapse between avulsion and replantation was found to be at good level. Alhamdulillah. This is the only group of non-dental healthcare workers who have sufficient knowledge. I think maybe because the pediatrician, during their training, they had some sort of dental trauma module. I don't know. But what they found out is actually the knowledge is actually among pediatricians is good, all right? Especially in terms of handling avulsed tooth, the medium of transportation, and the significance time lapse between the avulsion and also replantation. These three things are very important: how to handle avulsed tooth, the medium of transportation, and also the time lapse. That hence the title Race Against Time. These three things we will discuss right after this, right? Now we already look at the different group, like the physician, the ED, the medical doctor, the ambulance services, the pediatrician, different group. But how about the global knowledge of non-dental healthcare workers, right? So there is a recent study which has recently been published in Journal of Injury, a very well-known journal in trauma. It was recently published. This is the global status of knowledge for the prevention and emergency management of traumatic dental injuries among non-dental healthcare professionals. They did a systematic review, they did a meta-analysis. If you don't know what is systematic review and meta-analysis, no problem. What I'm going to share with you is the conclusion. So what they concluded, this systematic review and the meta-analysis concluded the knowledge of non-dental healthcare workers regarding the emergency management of traumatic dental injuries was insufficient or low in majority of the studies, meaning that senang cerita memang it is insufficient and low. Okay, there was a paucity of studies, meaning that ada gap, a study especially from Australia and also from some countries in Europe, right? And this is maybe because of different classification they use for trauma, different methods they use for questionnaire. But the main conclusion is actually the knowledge of non-dental healthcare professional regarding the emergency management of traumatic injuries, dental injuries, was insufficient or low. All right, that is what we are trying to address here. Now, we go straight away to the managing avulsed permanent tooth. If you notice that there are at least 10 classification or type of dental trauma, but I only address one, which is avulsed permanent tooth, because one, the avulsion is the only is the most severe type of dental trauma and is the only type of dental trauma that have time punya limit. All right, the cut-off point is 60 minutes or 1 hour. Okay, and then most of the studies, when they do survey or they do questionnaire on dental trauma, usually they will do on avulsion, because other type of dental trauma, it is not that severe, right? It is not that urgent that you have to refer. I mean, of course, when you have to refer immediately. But specifically for avulsion, they have a timeline of 60 minutes or 1 hour that you have to catch, right? So what is avulsion? It is actually the tooth that has completely been knocked out. Satu gigi tu terkeluar terus. Bukan crown saja, not only Crown, not only the root, the whole tooth from the crown up to the root. Semua gigi terkeluar. So that is what we call a avulsed tooth. Okay. Now we go a little bit. I think it's 8:45. Just a little bit more. So avulsion of the permanent teeth is seen in almost up to 60% of all dental injuries. In some countries, it's not that common. In Swedish countries, it is common because they use a lot of traveling using bicycle. Okay, because in the Swedish country, if you notice earlier in the early of my presentation, I put IADT. They were first established in the Swedish country because at that time, in 1980 something, there's a lot of dental trauma occurs. All right, there are no standard at that time. So in our countries, we don't use bike as often as in Swedish country. Sekarang ni barulah ada yang acah-acah nak naik basikal kan. Okay, so avulsion is 0.5% to up to 16%. Okay, and it is one of the most serious dental injuries. Now, the prognosis of dental avulsion is very much dependent on the action taken at the place of accident and probably following the avulsion. So again, I repeat, the prognosis is actually depends on the action taken at the place of accident and probably after the avulsion happens. So meaning that if it is avulsed, what you do right after that actually determine the prognosis. So emergency medical services or emergency physician, they see a greater portion of emergency dental avulsion. Sorry, it was supposed to be that dental avulsion, whereas dentists rarely give first aid at the scene of accident. So we usually see a case of referral. Okay, we don't see at the trauma punya scene. Okay, the most appropriate treatment is the immediate replantation of the tooth into its socket at the scene of the accident. Okay, this is the most recommended. The patient fall down, okay, gigi terkeluar. What you can do is ambil gigi, masukkan terus dalam soket tu, okay. Or if you cannot do that, okay, you have to do urgent referral to dentist as soon as possible with the tooth stored in the proper medium. Kalau if you cannot put replant the tooth inside the socket, you have to refer to dental clinic as soon as possible. And then you have to put the tooth in a medium. Jangan biar dia kering macam tu. I will show you some of the medium. Replantation is always the treatment of choice, but it cannot always be carried out. Sometimes it cannot be carried out because it happens most of the time at school. Budak-budak kan tengah berlari-lari, hari sukan, main-main dekat kantin, dia jatuh and avulse. In fact, we have a few sessions with Jabatan Pendidikan on how to educate teachers to do first aider ataupun untuk masukkan gigi ataupun how to manage that, because that is very important. Okay, some teachers they are very ambitious. Dia masukkan je lah gigi tu. Some teachers takut-takut sikit. Alamak, takut dah tengok darah. It is okay. Okay, if you cannot replant for whatever reason, put in the storage medium and send to the hospital or dentist as soon as possible. Now the concept, the approach is actually to replant the tooth unless it is contraindicated. Right? Now, at the trauma scene or at the ED department, this is where the patient first, or the trauma happened or the patient first attended. Dentists should be prepared to give appropriate advice to the public about the first aid for avulsed tooth, right? So instruction may be given by telephone to people at the emergency site. Emergency site, it can be at the ED, it can be at school, it can be at any public places. Sometimes this guy or this child fall down, gigi knock out, and then they don't know, but then they know, oh, I have one dentist on my contact. I want to call him, and then you have to be able to give instruction on how to save that tooth, right? Immediate replantation of the avulsed tooth is the best treatment at the place of accident. If you are unable to replant, and then you have to put the tooth in storage medium. The reason why is that you want to avoid dryness, not dryness of the tooth. If you imagine, this is the tooth, this is the bone. Okay, the tooth is not directly attached to the bone. So between the tooth and the bone, there is what we call ligament, PDL ligament, periodontal ligament. So this periodontal ligament is so strong that sometimes it makes extraction, cabut gigi tu very difficult. Kalau you tengok nak cabut gigi susah. That is because how strong is the ligament attached between the tooth and the bone, right? So when the tooth avulses, gigi tu terkeluar, Okay, they also carry some sort of viable ligament as well with the root. Dekat gigi, dekat root tu, there will be some PDL as well, ligament as well. So the aim is actually to avoid dryness of the ligament, because the moment gigi tu memang dah terkeluar dah, alright? But you want to avoid the dryness of the ligament. Now, what you can do at the crime scene, or not the crime scene lah, I mean the traumatic trauma scene, is actually keep the patient calm and make sure it is permanent too. Alright? Make sure you keep the patient calm. Jangan the patient tu dah menggelabah, dengan you sekali menggelabah. Padahal bukan anak orang pun sebenarnya, tapi tak tahu kenapa kita menggelabah sekali. Alright? Make sure the patient is calm, you are calm, everyone is calm. Alright? And make sure it is a permanent too. Gigi kekal. Okay, if it is a primary, do not replant the primary tooth, because if you replant the primary tooth, you masukkan gigi tu, it will injure the developing permanent dekat dalam. So if it is primary tooth, then you don't have to do anything. Just refer to the dental clinic, then the patient can go to the dental clinic. But if it is permanent, whenever possible, if you are okay, then you masukkan dalam socket balik. Or if not, you put dalam media store and then send patient for emergency. Alright? And then the timeline from the trauma happen avulsion to the completion of treatment, either at ED or at dental clinic, it should be less than 60 minutes. Ideally, it should be less than 60 minutes, right? Now, what you can do is that if once the patient dah jatuh, fall down, find the tooth and pick it up by the crown. Okay, jangan gatal nak pegang dia punya akar tu, because at that root area there is ligament. We don't want to pose more trauma to the ligament. You put by the you hold by the crown, pegang crown dia yang gigi keluar ni kan, pegang dekat situ. Okay, avoid touching the root. Okay, and then what you can do is you can try to replant to its original position, and then encourage the patient or guardian or teacher or other person to replant the tooth immediately at emergency site. Now, patient should bite on gauze, handkerchief or napkin to hold the tooth in place, because gigi ni, the moment dia punya ligament dah tear, bila you masuk, it tends to lose. Dia akan tend untuk jatuh balik. So what you can do is you ask the patient to bite on gauze ke handkerchief ke napkin untuk hold the tooth in place. The reason why is actually the PDL, the ligament yang surrounding the root, is actually can live in the socket. Once dia masuk dalam socket, dia okay dah, right? If the replantation at the accident site is not possible or it's not feasible, place the tooth as soon as possible in a storage medium or transport medium that is immediately available at the emergency site. Okay, the tooth can be then be brought with the patient to the emergency clinic. Okay, so what are the storage medium? The best or the gold standard is Heinz Balance Sound Solution, but this one is not always available, and it is expensive. Another option is that you can put in the milk, or you can put in saline solution, you can put in saliva, and you can put in coconut water. Ini some of the common practical storage medium. If you cannot replant, put the tooth in one of these storage medium and bring the patient and the tooth immediately to the dental clinic or ED. Now, when I mention saliva here, it is actually patient saliva. Bukan public punya saliva. You kumpul public, seorang sikit ludah, you letak gigi dalam tu. It doesn't work like that. Because I have a case that the patient bring, it's actually at the main bola. Patient main bola jatuh, luka. But when we wanted to replant the tooth at the clinic, the tooth was put in the container containing saliva. The patient refused. I kata, this is the first time that the patient don't want the tooth to be replanted. I said, why do you want to replant? They said that the kid told me that, imagine kalau you main bola kan, one team ada 11 orang. Kalau you ada 2 team, 22 orang. 22 orang ludah dalam tu, saliva. It is not meant for your team punya saliva. You letak gigi tu. It is meant for your own saliva, patient punya saliva. If your saliva tu masa you ludah ada blood, let it be. Tak ada masalah. Jangan you tengok saliva patient sikit ni, you pun tolong ludah dalam tu. Don't do that. Alright? Okay, the key points in management of tooth avulsion ada 3. First, 60 minutes rule. Okay, from trauma happens, avulse to tooth implantation, either at the trauma scene or ED or dental clinic, it should happen within 60 minutes. The moment it reach more than 60 minutes, the prognosis will go very, very low. Right? The longer the tooth is outside socket, we call it extra alveolar dry time, the poorer the prognosis. Okay, this is because it's all dependent on the viability of the periodontal ligament surrounding the root. Okay, and then another one is young tooth. Young tooth usually for the front teeth, among children at the age of 7 to 9 years old has better prognosis to mature tooth, those who are 9 years old and above. This is because in young tooth, or we call it immature, the root is still open. The root dia tu besar sikit, dia tak betul-betul tutup. When the root is open, there is vascular supply. There is a lot of supply. There is a lot of healing that takes place, and the prognosis is better. Alright. If you had to choose between avulsion of 9 years old, or 10 years old, or 7 years old, 7 years old avulsion has better prognosis compared to 9 to 10 years old because of the young tooth. But provided the management is the same, right? Now, another key point is actually the replanted tooth. Whenever possible, always replant. Tak kira lah. Okay, replant kat mana pun, dekat trauma scene ke, dekat ED ke, on the way nak pergi kat dental, kalau sempat masukkan je. Alright. If you can't, then put in the storage medium to keep the tooth hydrated. Alright. Now, the management. This is, I think I have 2 or 3 more slides. The choice depends on the root maturity and the condition of the ligament. Okay. After extra alveolar dry time of 30 minutes, most of the PDL are non-viable. Okay, so they give sometimes 30 minutes, but we take like 1 hour, 60 minutes. So you have to minimize the dry time for the survival of the ligament cell. Okay, the information regarding the dry time and the tooth prior to the implantation is very important to be obtained as part of your history. Bila you ambil history tu, history of the trauma, take as well pukul berapa dia jatuh, how do you manage that tooth at the scene. Okay. Now, the root maturity, again, I mentioned mature or young or matured, and the condition of the PDL. The most likely viable is actually if you can replant the tooth within or less than 15 minutes. Or it can be viable but compromised, for example, if you put in the storage medium and you go to the dental clinic less than 60 minutes. But it is likely to be non-viable if the extraoral dry time or the tooth is actually outside the socket or dry more than 60 minutes, regardless if you put in what storage sekalipun. Right? So the aim is actually to replant as soon as possible. Now, this is the PG where the oral health program, Ministry of Health, KKM, we published this, the 3rd edition of the management of a valve permanent anterior teeth. I was quite lucky because I was invited to be part of the development group. I think it took us 2 years to do this guideline. All right. This is at the end of our meeting before we published the CPG. It was recently published in December 2019 or 2020. You can look up in the CPG in under KKM. Right. So what I'm going to show you, this is a short video where we actually simplified step for managing a valve permanent tooth. So what happened is actually you pick up by the crown, okay? Hold the tooth by the crown. This is imagine the patient is already at the dental clinic, all right? The tooth is stored in the storage medium. And then you rinse the root surface, masuk, takut ada contamination, takut ada any debris. And then you place the tooth back in the storage medium. So while waiting for that, you give local anesthetic. Bagi local so that patient tak rasa sakit, all right? So once you give, this is just to show you example sajalah. So you give on the both side, labial and also the palatal. Okay, this is the time where you take history. Everything has to happen at this stage, right? And then after that, you check the alveolar socket. Look at the socket. Dalam socket tu ada fractured ke tak, any factors that actually prevent the tooth from being replanted later. Alright. If there is fracture, then you can manipulate untuk create balik the socket. And then after that, once you know that the socket is ready, you cleanse the socket. Sometimes there is coagulum, sometimes there is blood clot, sometimes ada debris kat situ. Kalau jatuh dekat tar, sometimes dalam tu ada tar pun. So you have to remove that. Kalau tak nanti it will becomes very it will be a source of infection. Then after that, you check the wire splint. This is for splinting. Okay. Okay, once you are ready, you hold the tooth by the crown, all right? And then you apply the tooth dalam socket with slight digital pressure. Tekan sikit. Jangan tekan sangat, nanti tak pasal-pasal gigi termasuk ke dalam pula. So you tekan. I mean, in this case, you would expect gigi tu terkeluar sikit, which is normal. So once the tooth is already in place, then you put the splinting. This is to stabilize. Usually we put the splinting for up to 10 to 14 days. All right? So once you split, because we wanted the tooth to maintain there, so this one is how we manage in dental clinic. There are, I have to mention, it depends very much. This is the simplified step. There are other steps as well where it involves root canal treatment, it involves other type of intervention as well. So basically, this is just to show you how we manage in dental clinic. And that has to happen from the time of trauma, jatuh, until we complete yang ada letak splint tu. That has to happen within 60 minutes. Right? So imagine the urgency. Right? Now, the key points again, 60 minutes rule, as I mentioned just now. Young tooth has more or better prognosis, and it is better to replant the tooth whenever possible. Right? So these are the common questions that was asked to me. Can the medical doctor or medical nurse replanted the tooth? Yes, the answer is yes. In fact, we did like a workshop with school teacher. Kita nak advise the school teacher to replant the tooth. Alright? What if the medical staff replant the tooth in the wrong position? Maksudnya yang depan duduk kat belakang, yang belakang duduk kat depan. Gigi tu terpusing. Kan? Because sometimes you don't know which one is which. Dimasukkan je kat situ. It is okay. It is better to replant the tooth in the wrong position than not to replant at all. Alright? Because if you come to the dental clinic, we check, oh, yeah, the tooth is rotated. Then we can de-rotate balik. No problem. Alright? When should the referral be made to dental in avulsion case? As soon as possible. Right? The referral should be made. I know it is the ideally everything should be done within 1 hour. From the moment that patient fall down up to we manage at the dental clinic dengan splint to 1 hour. So that is how urgent that we require the referral is, right? And can the tooth still be replanted even after 1 hour? Yes. We had cases, I think when I was in Hong Kong, we had cases that the patient came to us 2 days after the avulsion. Dia letak gigi tu dalam bekas plastik. I don't know if you remember orang dulu dia simpan gigi palsu dia dalam bekas plastik yang ada air. So they put that tooth in that. 2 days after that, they came to us. Dia kata, doktor, my son actually fell down, the tooth knocked out, this is the tooth. 2 hari lepas happened. So what we did was, we tried to replant that tooth. Okay, because it is always better to replant. If it fails, then you got nothing to lose pun. Gigi tu memang dah terkeluar. But of course, before you replant, there are other things you have to do. Canal treatment ke, you can do antibiotic punya surface punya tu ke. But it still can be replanted even after 1 hour. But the prognosis is very poor. Alright. So I just want to share with you. I had the opportunity. What people say that if you want to talk about dental trauma, it would not complete until you meet the person who the key person in dental trauma. So one of it is Dr. Barbara Mangren. So Dr. Barbara Mangren is actually from Karolinska Institute. Karolinska Institute is the top 10 dental school according to Times Higher Education, right? So she has done a lot of research. She has done a lot of guideline on dental trauma. And then another one is actually, I had the opportunity to meet Dr. Andreasen, Frances Andreasen. She is what we call the godmother of dental traumatology. Alright. Also, she is from Sweden. Kalau tengok rambut orang tadi pun duduk putih. Satu sebab tua lah. Okay. So this is actually one of the important event in my life in terms of dental trauma point of view, that I had a chance to meet the godmother herself. Alright. Dr. Andreasen, Frances Andreasen, I think she has done a lot of. She is in fact the founding member of IADT. Alright. So with that, thank you. This was taken before. This was taken before COVID. This is actually in Cappadocia. All right. Thank you. That's all. If there's any question, I'm more than happy to take the question. Thank you. Assalamualaikum.
Assalamualaikum, Dr. Faisal. Ada soalan di chat.
Oh, chat. Okay. Yes. Okay. Saya buka chat. Saya baca kat chat boleh? Alright, AMK, if our children has dental, okay, thank you for the informative talk, most welcome. If our children has dental trauma, where do we go? Can we go to suspect ED out of hours? And if local trauma, how early should we attend? Alright, of course, even after hours, let's say if after 5 o'clock, if the nearest dental clinic if it is ED, sometimes other dental clinic, especially in private, they open up until late at night. Okay, if you have the financial support, and if you don't have issue with financial, you can go to private clinic because they open up until 10 o'clock, because that is the first direct you can see the dentist. However, sometimes it also the trauma also associated with other injuries, all right, the lip lah, the tongue. Okay, so you might want to go to ED in suspect. You still can go to ED in suspect. Okay, so I really hope that if there is staff, ED staff in suspect, if you came across AVULSION, you can let us know. We don't mind to see the patient at ED at all to do this thing. All right. How early should we attend? As early as possible. Kalau boleh, hari ni trauma happen, semalam lagi you pergi klinik. Contohlah. What I'm saying is that kalau trauma tu jadi hari ni, pagi ni, try to attend as early as possible, because the later you pergi, the poorer the prognosis. Right? I think that is the general rule lah. The next question is, Doctor, maybe it's best to begin in educating MO in dental notation that has been used in Malaysia. I find not many of medical doctors know the notation like FDI or Palmer, which commonly being used internationally. Yeah, true. So it will ease to identify which tooth affected to injury. Also, this will ease the referral to respective dental team. I agreed with the suggestion that the idea of this webinar is not to teach everything, right? It's meant to create awareness. In future, we might want to do like a brief workshop with ED department, for example, or we can do a workshop among medical doctors, for example. Then we can do a bit further of what is the notation. We can do hands-on training. In fact, we did like a few hands-on training. We did like DOT, training of trainer for dentists in Malaysia for management of AVULSION. Yes, we can do that. It is a very good suggestion. Thank you. I think that's it. Ada soalan lagi ke? The AVULSED tooth, do we need to wash first? Okay. At the trauma scene ke at the clinic? Okay, at the trauma scene. If you can see dirt, okay, boleh basuh lah. But you know that kalau dia jatuh tu memang akan ada kotor. If you don't have what we call the access to clean water, then you can replant. Tapi kalau janganlah dia jatuh kat dalam kita panggil tempat yang kotor dan longkang tu, itu replant. Okay, worst case scenario you boleh lap je. Okay, tapi make sure don't injure the PDL lah. Ataupun you just basuh dengan air lain pun boleh. It is recommended to wash it first if you have the access lah. Another, I think that's it. Okay, again, Hansel, in avulsion of wisdom tooth in pits during intubation or airway device insertion in anesthesia, do we still have to keep the tooth for RCT or just let it be? Okay, this is quite interesting. If you do intubation, for example, and then suddenly the tooth avulse, you see, to make the tooth avulse, it is not easy because it requires a lot of impact and force. Okay, maybe we have to see whether that tooth is primary or permanent dulu. Okay, if it is primary, then no issue. We just inform the parents this is primary tooth. Sometimes gigi tu dia dah goyang, gigi geraham dekat belakang tu dah goyang. So mungkin masa NS nak buat intubation, dia terkena sikit gigi tu, dia tercabut. So if that's the case, there should be no issues, right? I think that's it. The question. If there's other question, Arif, ada ke?
Ada, Doctor.
Alright. Okay, if there's no question, shall I stop here? I'll pass back to Nadia. Nabila. Thank you.
Okay, thank you, Dr. Faisal, for the talk today. Hopefully, all of us can get benefits from this program. With that, we end our program with Tasbih Kifarah and Surah Al-As. Thank you.
Thank you. Assalamualaikum.